last time. So before we start for the new session, I just remember what questions were asked. I'll just sum up and tell you something about the questions. Now, there are some patients, which when they try to tell their symptoms, they are very vocal. They they're very exaggerated. No, they exaggerate. Even if they have, I had a case where the patient had problem acidity, and he said that I have lot of acidity. The acid comes coming up on the esophagus. I have lot of pain in the throat, and because of the acidity, it feels like burning, and the burning is like there was a lot of pain, and there's a lot of burning, and burning looks like charcoal, and the burning is so much I cannot do anything. It feels and makes me very. He keeps on going and going. Now, if this symptom the patient comes to you, you have to understand what the patient's mind is telling you. Okay. Now, Jyot, good afternoon. So this is I prescribe the patient a single and the patient lot of hiccups, and hiccups are very bad, and the patient says that whenever there is hiccup I feel very much burning because of hiccups, and because of hiccups I cannot sit in a place. It feels very embarrassing when I go out in public. So do something about it. I have to XYZ, and the patient keeps exaggerating his symptom. There is a beautiful rubric, in our repertory called as exaggerate symptom. So if you open that rubric, there are three remedies. I think one is asafoetida, one is plumbum, and there's one more remedy. So I give this patient a single dose of asafoetida 200, and I will not say it was very surprising because the prescription I made was making the summary of the whole case, and with asafoetida, his complaints were much better. So sometimes it is not only you ask the mind symptoms or you ask the body symptom, whatever the symptom, whatever the patient's symptoms are there, that makes you, oh, such an important thing, that makes in your heart or in your mind feel something very different or unique, please take that for prescription. Don't make it a routine that I have to ask only the mind symptom, and I have to ask only the body symptom, and I have to ask only the thermals. If you follow this type of fixity, you will never understand and you will never be able to be a good practitioner. Okay, so in this case I just took the symptom, exaggerate his symptom, and get to the remedy. Asafoetida has lot of other symptoms in relation to stomach, which I'll share with you. Before that, I'll just take a question. Good afternoon, Jyot. Dr. Motowani, good afternoon. Tell some medicines for severe nerve pain in left arm. Please add few symptoms more, Nitin, because it's nerve pain for left arm. There are a lot of remedies. So before you add symptom, I'll just tell you some symptoms of asafoetida which are very important. There are patients who come to you and they say that whenever I have to do hiccup, no, I have to do like this. So whenever he has hiccups, he finds it very difficult to get the wind. And this symptom the patient is doing in front of you, be sure that the patient is asafoetida. There's a beautiful symptom in the Mater Medica, great difficulty in bringing up wind. The only remedy you must think about is asafoetida. And because of this, there's a lot of great distension of the abdomen, and there is forcible eructation of gas. These are the very important symptoms which I have seen and confirmed in many of patients of asafoetida. If this symptoms comes to me, whether the disease is GRD or the disease is hiatus hernia or it is plain acidity or it is indigestion, this symptom has given me a lot of good results. 3 or 4 symptoms very important: great difficulty in bringing up wind, forcible eructation of gas, distension of abdomen. Very important in case of asafoetida. So before that, I'll just take one question. So please share some remedies for maxillary sinusitis. See, again, the questions, it's a very generalized question, and whenever there's a generalized questions, the remedies are lots and lots. So today we have the repertory, and when you open the repertory, there are so many symptoms, so many remedies, and it becomes very difficult to choose. For example, maxillary sinusitis, you can think about Calibicrom, Cilicia, Muxol, Hydrastis, Lycopodium, Thuja, Sulfur, Phosphorus, Pulsatilla, Lycopodium, lots and lots of remedies. Your question has to be a bit precise so that I can give you only 4 or 5 remedies. If the question is generalized, there are a lot of remedies for that. Okay, so female patient, unbearable pain left arm, particularly bicep, along with nerve pain, you can think about, uh, uh, affecting the bellies of muscles. I think one of the doctors would tell you the remedy. Female patient, aged 49, having disc problem during pain. She is having nauseous feeling. Yeah, Navjot, I have to basically tell you the remedy of the case you sent. I'll just do it today. Good afternoon, Dr. Abhishek. So, female patient, aged 49, having slip disc during pain. She is having nauseous feeling. Now, this is again a very, very important symptom. When there is nausea because of pain. Now, if you open, if you open the repertory, if you open the Mater Medica, this symptom, today only I think one of my doctors who is working with me, she came with a case where the patient had nausea in relation to some, I don't remember exactly, what were the complaints, but yeah, nausea whenever the patient is reading or studying. And I prescribed with that symptom only. Let's say I've given it today. I've called the patient after a month. Let's see how does the patient react. Now, nausea with pain. These symptoms, are very, very, uncommon. So there are 3-4 remedies now you must think about. Nausea with pain. The first remedy you think about is Iris versicularis. The second remedy is Vespa. Vespa means it is basically Vespa. It is called as giant hornmate. Third is Argentum nitricum. I have used Argentum nitricum with this symptom, nausea with pain and sciatica pain, in lot of patients with very good results. So you can think about this remedy also, nausea with pain. Now these are how you have to take the case. You have to always find a unique symptom that describes either the patient's personality or the patient's disease personality. In one of the case, it has to be a very unique symptom to prescribe. Very nice symptom, Dr. Navjot. And this is how you have to practice. Okay, Navjot, very nice. Sir, kindly tell some medicine for extreme irritable nature due to over stress. Irritable nature because of over stress is a very normal symptom, a normal rubric. You can go to the rubric irritability, mental exhaustion from a lot of remedies. Walaikum salam. I am Dr. Nafis from Islamabad. It's vitiligo, treatable if spreads. See, vitiligo, I would say treatable, one, because I have cases which I have cured. Second, very difficult to treat because I have some cases which have not shown good results. Third, it comes under one-sided disease, so there are very few symptoms to prescribe. But of course, again, a very important thing in that is a good case taking is important. And then prescribing on the miasm, that is syphilitic miasm. That is important. But if you ask me also, I also have difficulties sometimes in treating case of vitiligo, though I have lot of cases which I have cured with homeopathy medicine. Bladder carcinoma having frequent urination every 15 minutes, especially at night, along with severe pain which leads to weep. Very nice symptom. Now see, if you are treating a case of bladder cancer, okay, and the urination is profuse. Now in this case, because of the cancer, because of the space occupying lesion in the bladder, the patient is not able to hold the urination. In this case, there are so many remedies, but I would tell you some remedies which have given me very good results. For example, if you open your Mater Medica, if you open the repertory, urgent urine or increased urination, of course there are drugs which are very, very common like cantharis and all, but petroselenium, lycopodium, phosphorus, terebinthina, methylene blue, and there is one more remedy which I am not. It's again a rare remedy. I'll just remember that. So these 5 rare remedies have cadmium sulf. These remedies have given me very good results in case of cancer of bladder. I had a very interesting case of a 91-year-old person having a bladder tumor, which I cured with homemade medicines. I have the report before treatment also and after treatment also. Okay. Sir, I have a video related to case of child. I will send you. Okay, fine, Dr. Sir, kindly tell some medicines for severe nerve pain in the left bicep. You go and see there's a rubric, rheumatism affecting the bellies of muscle, and you can get the remedy. One of the remedy is Semasifuga, Actis picata. How to consult you from Pakistan, how to pay fees, also problem. The problem, there's a problem, but I think there might be doctors in Pakistan also who was mostly practicing homeopathy. You can always, because see, follow-up is very, very important. So if you can get the doctor available, it will be very good. I have given now and waiting for the patient. Yeah, okay. Terebinth, yeah, very nice. If you open the terebinth, there are and if you must think about methylene blue also. These are the remedies which basically would give you good results. Okay. Now, if you understand the Mater Medica of terebinth, if you open, I think most of the doctors might be using boric Mater Medica. Now, if you allow me to, if you tell me something about terebinth, which symptom you have, used for prescription, that is important. But in terebinth, there are few symptoms which are so important that have given me very good results in my practice. I'll just narrate one or two symptoms which are very. First is there is strangury with bloody urine. Whenever there is a bloody urine, either it is urethritis, either it is kidney problem, terebinth is a very important remedy. It is said in terebinth, remember my wordings, it is said in terebinth, inflammation of the kidney following any acute disease. For example, if the patient is suffering from pharyngitis, laryngitis, rhinitis, mastitis, mastoiditis, uh, IITS, you have cured that, or it has been cured with any of the medicine, and the patient comes to you with severe pain in the kidney, burning in the urination, and a lot of problem related to kidney inflammation. The first drug you must think about is terebinthina. Don't always give carbovage after exhausting disease. Carbovage, of course, it is there, but whenever there is inflammation of kidney followed by any acute disease, my dear doctors, think about terebinth. 30 potency I have given, and it has given me very good results. The main symptom in the terebinthina should be there is a continuous tenesmus. There is a continuous tenesmus. Otherwise, when there is continuous tenesmus, we think about cantheris. See, cantheris has everything in relation to urine, like CP has everything in relation to menses. Now, continuous tenesmus, pain before, during, after. So, continuous tenesmus, inflammation of kidney after acute disease, strangury with bloody urine. These are the 3-4 very important symptoms of terebinth, and these symptoms will always, whatever the name of the disease, these symptoms are there, you must think about terebinth. Also think about methylene blue. This must be a homework. Go home and see about methylene blue. That's a dye. Methylene blue is a dye, and it is one of the aniline dyes. This also remedy has given me very good results. Don't always think about cantheris or petroselenium or berberis or sarsaparilla. They are there, but take a note of this also. For example, just one thing I told you about terebinth, that inflammation of the kidney after acute disease. In terebinth, just remember one symptom: surgical kidney with large amount of pus in the urine. The patient comes to you with hundreds of pus cells, lot of pus in the urine, infection in the kidney, lot of pain, the patient has fever. It is called as a condition where the kidney has to be removed because of lot of inflammation and lot of pus formation. In that case, do think about methylene blue. Rest you can go home and think and read methylene blue. It has a very good results in cases of any diseases. The symptom is important. Can I use Cinerea martima eye drop for eyes, dry eyes? Yeah, you can use Cinerea. Whenever the patient comes to me also and this says a doctor keep some eye drop because of cataract, Cinerea works very well. Though I have potency of Cinerea also, so I give in repetition low potency of Cinerea. But if the patient is insisting that give some eye drops, you can give Cinerea. Priapism is a patient with chronic myeloid leukemia. Of course, if you see terebinth also, it has also got priapism. Cantheris, lot of remedies. Patient having continuous tenesmus along with bloody urine. Yeah. So see the symptom of terebinth. It is so close to cancer and growth, space occupation lesion of bladder. Okay, most of the symptoms in this case would lead to terebinth. So this is a classical symptom of terebinth. In pathological case, we have to start with 30. Yeah, according to Hahnemann, in pathological cases, you have to start with low potency. But because Hahnemann has told something about the LM potency. So I basically try to give LM potency. It's from 0-1. It is automatically the low potency, and you can give repetition also. Of late, I have made my own potency, and I have named it as Abdequaem's imprinting paradigm, where I have again diluted the potencies more than that, and I'm using those potencies with very good results. But if available, try to use the LM potency first. Otherwise, you can start with 6 potency also. You can try with 12 potency also. I have 12 potency also, which I use. In case of gross pathological conditions, you can use 6, 9 also and 12 also. Okay. So let us go forward. Few questions have been scrolled up. So if you don't mind, you can please write down the questions again. Scenario. Yeah. So I was just telling you something about terebinth and something about methylene blue. These are very, very important remedies which you must take note of in your Mater Medica. Okay. Symptom wise, one symptom of terebinth and one symptom of methylene blue, which I found very important in my practice, that you should think about. There are few remedies also, what you call, ossimum. That is also very interesting remedy for urine complaints. You can go home and eat ossimum sand, ossimum can. These are also very good remedies for urine complaints and in relation to space occupying lesions. Okay, so yeah, Navjot. In case where you find that the cause is renal colic, and there is a lot of distension of bladder and there is a lot of pain, and the pain goes down to the thighs. In that case, you must think about Pariria brava. The patient has too much swelling during sweating, during social anxiety. Is Lycopodium a good option? Yeah, Lycopodium is a good option. You can think about if the symptoms correspond. Medicines for patient with chronic cystitis, urine with full field pus but no RBCs, frequent urination with drops and burning. Okay, so today I think we are only concentrating about urine complaints. See, first of all, most of the remedies which you know about urinary complaints, starting from Cantharis or Sarsaparilla or hydrangea, Pariria, terebinth, methylene blue, most of the remedies have all the symptoms what you have told, because in urinary complaints, in case of cystitis, frequent urination, painful urination are the very common symptoms. Just ask one symptom to the patient. What is the patient feeling because of these complaints? He feels that nothing is possible. I cannot go to the doctor. I will go to the doctor, so he'll give me some injection or dilatation will do. I cannot. I have fear of that. So, what are the repercussions because of these symptoms the patient is suffering from? If you can add to that symptoms, of course, then it will make a case which you can cure. Because in homeopathy, of course, if the physical symptoms correspond, which I always tell, if it is basic that physical symptoms have defines the patient disease, then you can give any remedy. But if you ask one step ahead and if you get the remedy, well and good. In your case, chronic cystitis with urine filled with pus, you can think about Lycopodium, you can think about Pectoselenium, of course you can think about methylene blue, or you can think also about Pariria brava. But Pariria brava is secondary pus formation or a lot of pus in the kidney because of renal colic. So cystitis, you can think about phosphorus also. Okay, just match the thermals and match one of the symptoms so that you can get the right remedy. So let us go forward. Sir, if indications like post-acute kidney inflammation suggest terebinth, but other generals give indication of some other remedy, well-proved medicine, then which one to select in this type of confusion? No. Try to have no confusion, Dr. Saab. Try to have no confusion. What Kant says, if the generals match, then give that remedy. And when we were very early in our practice, or we just passed out, and we had the same confusion. If the patient comes and tells us that if the aggravation is 4 o'clock p.m., but the patient says that I am better by rest and aggravation by motion, if I move I have pain. So what to give? Whether to give bryonia or whether to give Lycopodium because of aggravation. In this case, don't have any confusion. First match the generals, then the mind symptom. If that matches, and if it is a polygraph remedy, please give that remedy. And if that does not match and you are not sure about your own interpretation, then see what is the defining feature of that disease per se of the organ. For example, Abyss niger has a feeling as if a hard-boiled egg has been lodged at the cardiac end of stomach. And the patient says that I feel that something is stuck up here, I cannot take it inside and it does not come out also. His disease, his mind is always concentrated on the cardiac end of stomach, then Abyss niger works wonderfully. Okay, so this is acute and that is chronic. If the generals match, give that remedy. Can Naxomica be taken with other homeopathy medicines? When you are already giving homeopathy medicine, then why you want to give Naxomica? That is the first question. But don't just believe that Naxomica is an antidote. So if we give Naxomica, everything will be antidoted. It is not. It is in our head. It is in our mind. It is not that the patient comes to us. He has taken a lot of allopathy medicines. We give Naxomica, everything is antidoted, and then we can start. It is not like that. The similimum indicated during your case taking is basically the antidote and curative both. If you ask me, in my practice, I follow that. Okay. Thank you, Sheetal. Thank you so much, Nitin. So, as I told you, don't just believe Naxomic only for antidote. And if the patient is phosphorus, and if you're giving phosphorus to the patient, why to give Naxomic? I don't know. So don't mix the medicines. Both are polychrist. Okay. So let us go forward. Now, there was one question regarding rectal symptom, that if there is a lot of itching in the anus and there is a lot of swelling, what to give? And there is so much pain with stools and after stools, and the doctor says that I had given them Esculus, Hemimelis, and nothing is working. In this case, remember only one thing, if there are only two symptoms and the patient says, sir, forget everything, forget my mind, body, just treat this, there is so much pain when I go for stools and after the stools. One symptom. And second symptom, there is a lot of swelling of the anal orifice. If you have only these two symptoms, then you must think about one remedy, and that is Paeonia. Paeonia. Whenever a patient comes to me, and maybe the drugs which I have selected, for example, Esculus or Hemimelis or sulfur or Naxomica, which are the routine prescription, and the patient is not better, then you must think about, it is written in the Mater Medica, atrocious pain with and after each stools, and the remedy is Paeonia. Yes, I'll add one thing in that Paeonia case. It's a very interesting remedy for fistula, because it is written that painful ulcer or very offensive discharge or moisture on the perineum, that is Paeonia. And because of the discharge and because of that flow, there is a crust formation. The anus is the perineum is covered with a crust, and that is a classical symptom of Paeonia. Paeonia. Sir, my husband TG-LIVE 225 now, which used to increase very frequently after last 2 years back, which you gave medicine. This time not. Yeah, Navjot. So yeah, this was a fantastic case, and thank you for sharing, Navjot. I think 2 years back, if I am not mistaken, we had given a dose of Lycopodium, one dose. And see, everybody look at this case. I think I had given his husband Lycopodium 200 single dose, and now it has 2 years have passed. I don't think we have repeated any medicines for 2 years, and still the triglyceride and the cholesterol is normal. Yeah, Lycopodium. So I think my memory is still good. So I remember Lycopodium in this case. So this is the beauty of homeopathy. In 2 years, we have not repeated a single dose of any other medicine, and still the patient's TG levels and the cholesterols are normal. So owing to the sometimes scarcity of time and the printing and the videos and all, I have minimized my shooting and all, but there are beautiful results in homeopathy where single dose can give results within 2 or 3 days. If I am not mistaken, I think Navjot, we give Lycopodium, and we checked the result, I think after a week also and 4 days also, and within 4 days the cholesterol came to normal. I remember this case. It's a beautiful case, and I don't know why I prescribed Lycopodium, because I forgot the symptoms, but I know the case very well. Thank you so much, and thank you for remembering, because whenever we cure something, some adrenal rush comes and we are very happy, so that we are doing something. Every doctor needs some adrenal rush. So let us go forward. Any medicines for severe insomnia? See, for severe insomnia, any doctor would tell you Passiflora and all, but I have stopped prescribing on these. I have stopped prescribing on these symptoms for disease-wise. Yeah, you shared the results with me, Dr. Navjot, but taking the printout and keeping a record and then making PPTs, it's sometimes become very difficult because of the shortage of time. So we just finished Peonia for, insomnia. You can think about Passiflora, Pisidia, Califos, Avena sativa, lot of remedies, but I don't prescribe on disease, so I need some symptom to prescribe. So let us go forward. I hope this about urination, the urination symptoms are taken care of. So let us go forward. If we have some symptoms, there are one question on the WhatsApp and Skype also. Yeah, now I plan to visit you for the, okay, nice. So let us go forward. Something in relation to, yeah, somebody asked me something about Staphylococcus urine symptoms. See, all polychorists have all the symptoms in their mater, and Staphylococcus also has a very interesting symptom. If you open Staphylococcus, it is a very, very important remedy. If in fact, boric mater, there is one symptom of Staphylococcus called as cystocele. Cystocele. It is written in boric mater, cystocele locally and internally. Normally we avoid local application, but cystocele locally and internally, the only remedy is Staphylococcus. So this is the importance of, sometimes, if your mathematica is good, you can always jump and you can always have that. And one symptom, of Staphylococcus, which everybody knows, sensation as if a drop of urine were rolling continuously along the channel. These two symptom of, Staphylococcus I remember. And whenever we used to study, methylene blue. In methylene blue, it is surgical kidney and symptoms. In Staphylococcus, it is pain after lithotomy. The only remedy I have prescribed is Staphylococcus. Pain after lithotomy. Okay. Now just go home and first of all see what is lithotomy. It is a surgical removal of stone. And a lot of patient comes to a doctor, the stone has been removed, either it is gallstones or UTI stones or bladder stones, but the pain still remains during urination. And the only remedy you must think about is Staphylococcus. So pain after lithotomy is a very important remedy, Staphylococcus. So this is how you have to study comparative mathematics. If my if the doctors are listening who are studying with me, this is what I want when I am teaching you therapeutics, surgical kidney, lithotomy, cystocele, so that it becomes easy for us to understand the patient and then prescribe. Okay, this is how. Otherwise, renal stones, 5 remedies, I tell you symptoms, you understand for 1 week, next week you have forgotten. It should not be like that. Hello, I have everybody is understanding what I'm telling, because I cannot see anybody writing that he's understanding. Okay, I hope you are. Yeah. So please tell remedy for cough from tickling under the chin. Tried calcarea carb, rumex, tannum, corallium. Tickling under the chin. Surprisingly, normally when you have tickling in the throat or tickling in the throat pit, I have seen remedies, but tickling in the chin and the patient has cough. I have a case where the patient has itching in the chin and then the cough starts. So I can tell you that remedy, but in my practice I have hardly seen a case where the patient has tickling in the chin and cough. So I have tickling in the throat or the larynx or the pharynx. I have this case, but tickling in the chin I don't know. So I don't think I'll be able to answer this question. But if you can't get the remedy because of that symptom, understand how is the cough. Dry cough, wet cough, before, after, modality, morning, night, pain, without pain, expectoration, without expectoration. If you get this, you can get the remedy. So if you find the symptom very unique but you cannot get the remedy, you can enter the case from other symptoms also. That is what I look. I don't fixed ideas. If you don't get mind symptom, how will you prescribe? Go from the bodily symptoms. Okay, so this is, I said non-verbal communication. So there's non-verbal communication. If you're good at that, how the patient sleeps, how the patient eats, how the hairs, how is the perspiration, how is the skin. These are also other things you can enter the case through. Okay, so let us go forward. If some questions are not answered properly or I have missed out, you can always write again, so that I can answer you. So this is something in relation to urine complaints and the cough complaints. Zeenat Kausar Purnima Anurag. Okay. So I think these are the only questions which are there till date. It is already half an hour up, and thank you everyone for joining. I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you so much. Until next Saturday, goodbye.